This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week we are talking about flu season. Flu season is upon us, and we always like to talk about the importance of vaccination and trying to stay healthy during the season. I'm at the KRMC Quality Management Office, and my guests today are Carroll Howard, she's an infection preventionist, and Gena Durrett. They're both infection preventionists. Hi, ladies. Welcome.
Hi.
Hello.
This is important stuff. We try to keep people healthy, and in quality management, this is a big part of. Can we start with that? Just a little side note. What does quality management do here at the hospital?
Oh boy, quality management is such a huge spectrum of things that it does. We run a lot
Patient safety.
Yeah, we do
employee
patient safety, employee safety.
Right.
Infection prevention.
Yeah, we audit. We get the hospital ready for state inspections. Yeah, so it's just, I can't even list everything that we do.
Right. And as pertaining to infectious disease, this becomes your concern because, help me tie that together. Well, you made a face at me. No, but I'm thinking about flu, right? And you want to...
Well, everything that we do...
Was it that dumb of a question?
No, it was a loaded question. I don't think that she had an answer for it. She was like, well, where do I start?
I threw you a pitch I thought you could hit.
Infection prevention runs a whole gamut of things, especially with patient safety. One of our biggest focuses is everything.
We focus on superbugs and contagious things like that, but the flu is a big thing because that's somewhat preventable if you get your flu vaccine.
Right.
Sometimes the flu season is totally different than the strain is different than what we think we're going to get. Because I think they get it in Australia first or something like that, and they kind of base our serum off of what their viruses are.
Right.
But sometimes it's spot on, so it can really prevent people from being sick, malaise. It could be fatal for other people.
And Carroll, you will have patients, you'll have patients coming in and out throughout flu season, and you want to, if you can help the community to get vaccinated with the flu vaccine, right? If you can encourage them to do that, then that will also help you to circumvent a lot of problems that you could have here.
Correct.
Right?
Correct. Plus, if us as an employee taking care of a patient were to expose somebody and make them sick when they're here, maybe having an operation, so they're immune compromised at the time, that's a shame if we would have gotten our flu shot.
And so it's also important for the employees to get their flu shots.
Absolutely. Absolutely it is.
And that's a commitment that
yes, everybody here is supposed to get their flu shot.
Right.
Annually.
Very good.
It's mandatory.
Gena, something that I think is really interesting about the flu virus in particular is each year it changes, right? The strain is a little bit different.
It does. And unfortunately, you can't guarantee that the flu shot that you have available is going to be effective against the virus that is going around. But they do the best that they can, and we just hope for the best.
Yeah.
Yeah.
And what do we know? Well, here's the first question. When is our flu season here in Arizona?
The flu season runs from October to officially March, but it can run after that all the way into May. So it's actually a very long period of time. Some people think that it's not effective to get a flu shot after November because, that's when everybody's getting sick.
Like it's too late or something.
Yeah, it's too late, but there's no such thing as being too late. If you need to get your flu shot, you're going to be covered for the entire season.
A couple of years ago, our flu season didn't hit really big until summertime.
Yeah.
So really
that's
late.
Crazy.
Yeah. We
So
had a summer
it still
flu
would have
season.
benefited those that would have received their flu shot later.
It was actually
Absolutely.
in the summer season.
Yeah.
That's crazy.
Yeah. We've had hardly any cases during the flu season and lots afterwards.
That has to be anomalous, right? This.
Yeah, that's not the usual case.
No, it was
Right.
like 2 or 3 years ago.
Yeah.
Well, so if I get a flu shot, then how long how long does that immunization carry me?
It's supposed to be good for the year.
Right.
So.
Okay.
Now, some people, if they are elderly and if their immune system is compromised, CDC suggests that you get vaccinated twice.
Oh, okay.
Yeah,
So-
I never heard that.
I remember that.
Yeah. But if there's, of course, any question,
booster.
people should talk to their doctors about that.
Right. So I do want to get into who should get, at least I think I've heard in the past that certain people should sit out the vaccine, but in general, we encourage the vast majority of the population. So I do want to get into that. First, I wanted to ask, though, what do we know? Do we know much about this year's strain of what to expect?
We don't really know a whole lot yet.
Yeah.
We haven't seen any positive cases yet in the hospital, but we are expecting them to start hitting anytime.
Right. Okay. So let's see. It's flu season. I need a flu shot, but I'm reluctant. I don't like needles. I've heard that it's not that effective. I've heard that it can give me the flu, and I don't want that to happen. Convince me to get a flu shot, would you?
I'll do my best. We'll do our best. The flu vaccine is not a live virus. A lot of people think that as soon as they get the vaccine, they get sick. It's not true. They don't have influenza. Chances are they have common cold. And unfortunately, we don't have a vaccine against that. So getting the flu shot is not going to make you sick at all.
Just a myth.
Just
the site may be sore, or it might get red or warm or swollen.
Right.
But that's about it. A
And
couple
so-
days later, your arm's fine.
And if you were sick, then
I wouldn't
it
recommend.
was bad timing.
Yeah, I wouldn't recommend to get it if you already know you're sick.
Okay, right.
Because your body's already fighting something else, and it doesn't work well that way.
okay.
It knocks you down really good.
Here's a question for you then. I think I'm interrupting, so hold those other thoughts. No, but if I get an early case of flu in October, I'm the first one in Mojave County.
Congratulations.
Yeah, right. I win the dubious prize. Then November, December, should I get a vaccine?
Absolutely.
Yeah.
Yeah.
It's not like chicken pox where I had it
No,
once and I don't have to
it's not
worry.
like chicken pox. Unfortunately, the flu virus mutates. It changes every single year.
Right.
And this year, it still has the H1N1 combo in it. So, in case that kind of shows its ugly head again.
Yeah.
Haven't seen that in a while, though.
And so as we were saying, like flu, I mean, it can be deadly to certain members of our community.
Absolutely.
Yeah.
And is it mostly because of dehydration?
No, immune compromised people, elderly, really young people, or people that have a bad immune system. Something like autoimmune diseases like RA, MS, stuff like that, or poor health in general. They don't take care of themselves. They don't eat right.
Right.
Specific lung diseases like emphysema,
There you go.
COPD,
Yeah.
asthma.
Right. It does take a certain amount of strength to fight off the flu.
Absolutely.
It'll knock you out.
It
right?
will. Yeah.
Who gets a flu shot? Wait, well, you were still convincing me to get a flu shot.
I was convincing you, yes, I was
Let's
trying
start
to.
back
You're not
with
convinced
that,
yet?
Gena,
Not
yeah.
convinced yet? Well, the CDC recommends that everybody over 6 months of age get a vaccine.
Okay.
But we always push towards people with chronic health issues and all of those other things that we already talked about.
Diabetics. What else?
Diabetics.
HIV.
Congestive heart failure.
I can't think of the list. There's a whole long
There's
list.
a huge long list.
Yeah.
Yeah, I don't have that list in front of me.
And perhaps it's a shorter list of who should sit this out and not get a vaccine, right? And who doesn't get a vaccine?
People that don't want it, that we can't convince.
People that have egg allergies can have an eggless.
Yeah, they have an eggless vaccine, so that is no longer an excuse.
Correct. What else is there?
Well, I guess I'm saying whom or who. Was there kitty fur on your
Yeah, it was
windscreen?
the kitten fur on there.
That would be Shiver. He's the kitty.
Oh, hi, Shiver.
Sometimes I record him and we get conversation. I apologize.
He's like Fuzzy Guy.
Right?
He's a very sweet boy. He's nothing to worry about, unless you have cat allergies.
I don't.
Anyway, so there are certain people you would recommend who don't get shots, right? Or like perhaps the very old, or does everybody get a flu shot?
Everybody gets it.
As long as you're 6 months old, you get a flu shot.
Yeah.
That's right. Some people think that if you're pregnant, you shouldn't get a flu shot, but that is also false. If a pregnant woman gets her vaccine while she's pregnant, it can pass on the immunity to the infant. It can actually protect them for a good couple of months after birth.
Okay, so
I got one when I was pregnant with my last one, and I'm still wondering if that's what's wrong with her. Don't listen, child. Don't listen.
let me just tell you. Here's a little secret.
Only kidding.
A few years ago, I did an interview with a couple of lovely people in quality management. Lovely people. I'm no criticism intended here. But when I set up the microphones, they didn't want to say anything because they were thinking from sort of a medical legal perspective. Like, and I'd ask a question, they kind of look at each other like, "Can we?" Right? It was like seeking a lawyer's counsel.
Right.
Like, should I say that? We decided we will not.
Can I phone a friend, please?
We'll decline to answer that. So when you suggest that the flu shot may be responsible for whatever's up with your daughter, that's actually really refreshing. So. It's break time on Focus on Your Health. We'll be back in a moment for more with Carroll Howard and Gena Durrett from KRMC Quality Management. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. At KRMC, we are committed to educating our community about the safe, responsible use of prescription medications. Keep your medication in a secure place and never share your prescription with anyone. KRMC. And welcome back to Focus on Your Health. I'm TG LaFredo, and this week my guests are Carroll Howard and Gena Durrett. They are infection preventionists with KRMC Quality Management. We're talking all about the flu vaccine and staying healthy this flu season. We should also talk about the other ways that we can, of course, we encourage people to go out and get their flu shots. But what are some of the other ways that we can stay healthy this flu season?
Well, the best way to prevent any infection is hand hygiene. You always want to wash your hands when they're visibly soiled, after you cough or sneeze. And when you do cough or sneeze, cough and sneeze into a tissue and immediately throw it away. Don't
rub it on a friend or anything.
Please don't
like
rub
that.
it on a friend.
And good hand hygiene.
Yeah, good hand hygiene, always. We stress that. We're the hand hygiene Nazis of KRMC now.
Do you have a card that says that?
I need to get one. I need to get a card that says hygiene Nazi.
Now, of course, hand hygiene is important, and I see the stations all around the hospital where you can get the alcohol and rub your hands. Mm-hmm. And you don't want to bring something in to a patient and get. But then I also hear people talk about how we've become too sanitized and we don't allow our immune systems. Is there anything to that? You know the argument, right?
Of course, I disagree. I do. I've heard that argument.
I'm sure,
and people
right.
wiping down the handrails on the grocery carts and stuff, and
right.
people saying,
and
"Well, that's ridiculous."
Right. And the reason you're getting sick is because George Carlin has a funny bit about that. Like he says, "Well, when we were kids, we swam in the Hudson River in raw sewage. No one ever got sick."
Didn't George Carlin die of cancer?
I think it's abuse of antibiotics
Point
for years and years more than the abuse of alcohol-based hand rubs. To be honest with you, yeah.
I have a nurse friend who assures me that all nurses have OCD. Do you have any comment?
That's a different area of nursing altogether. That's moving towards psych, and I was never a psych
I'm too
nurse.
lazy to have OCD.
You should have a plaque on your desk that says that's like a
put it on your name badge.
The anti-motivational poster.
Yeah, there you go.
Gena, we were talking about live and attenuated viruses. Mm-hmm. Can we go into that in just a little more detail? The one you said, it's an attenuated virus. It's not a live virus.
Correct.
Is what we get. Does a live virus exist in the world of flu vaccines or not at all?
I believe that it used to. I know that for a while they were doing a nasal spray. Weren't they doing a nasal spray last year?
We're not doing it here anymore.
Yeah, well, CDC doesn't recommend it this year.
Yeah.
The nasal
at
spray.
all. Correct.
It's
it's shots only.
Well, you just short-circuited my next question. I knew that there's the shot, there was the nasal spray. Was there another delivery method, or is that?
Nothing that I remember.
Okay.
No.
Not that I know of.
But the nasal spray is out. There were
Nasal spray is
complications
out for this year.
with-
I don't know if there was necessarily complications, but it would make sense if they were giving people a live virus in their
Correct.
sinus passage. That when I heard they were doing that, it really didn't make any sense.
Yeah.
But to me as a nurse,
Snort the flu.
right? Yes, that's a slogan for you.
We just found a name for this episode. Oh,
Yes.
so-
Okay, thank you for trying. That's okay. Thank
we
you.
couldn't make it happen.
Bummer.
She couldn't get a hold of anybody.
Okay. Well, okay. So we just had a guest. Someone opened the door here to our little
That was
meeting
Karen.
room. That was Karen. And we had talked about having somebody deliver a flu shot to me on the air. I have gotten shot on the air before, but we couldn't line that up this time. Is that right?
No.
No, we couldn't.
Well,
We didn't know that was an option. I would have set it up
didn't think about
yesterday.
it sooner. Yeah, we would have all had it all
a
arranged.
more responsible host would have helped to line that
Right,
up. but
thanks.
You
You
got
ruined
me
the whole
instead.
program.
So, but it does make for a good segue. How does one go about getting? You can get flu shots at your pharmacy.
Yeah. Mhm.
Even at Walmart and places
Yeah, they
like
have
that.
them at
right?
Walmart.
CVS,
they have them at
Walgreens,
at
Walmart.
the doctor's offices.
Doctor's offices. If you're married to a KRMC employee,
You get it.
family, children 12 years and older, I think they give the first round to our staff, and then like a month into it, they offer it to the family members 12 years and older for free.
Are they down there now?
They are.
Really?
Yes, they are.
So I
Buck
could
Health.
go pay them a visit?
Yeah, absolutely.
You sure could. Go ahead, do it.
I might see if somebody would be willing to record it though. That's for me. Nothing's worth doing. This one is worth doing. I don't want to get on your bad side. Last year I did not get my flu shot. I can't tell you why. It just didn't happen. And a couple of times my wife was like, "Have you stopped by yet and gotten your shot?" No.
Must
I
be
haven't.
stressful. Does she give you the
For
eye?
her. Yeah, I think she brings home every kind of. What's interesting, I don't know if it's interesting. You tell me if this is interesting. We were living in the Northeast, and we moved to South Carolina, where she had gotten a job, and we had been in the Northeast for quite some time. When we moved to South Carolina that first year, we were both so sick. We both got pneumonia. She hacked up blood. I coughed so hard that I broke a rib.
Oh,
Oh my
jeez.
And we got this whole set of new and interesting southern bugs that we hadn't been exposed to.
Like the smallpox.
I was just going to say, like, exactly.
Yeah,
Oh my gosh.
yeah. And then that was it. It was an awful winter, and then after that, yeah, we were okay. We got the worst of it. So yeah,
Wow.
she brings home lots of.
Oh, yeah. Doctors and nurses bring home everything
Children are the worst. Oh my goodness. Little kids bring home everything.
from school. Yeah.
Uh-huh. Luckily, by the time, if you wait till you're like my age to have the last one, I was 37. By the time you're that age, you've been exposed to almost everything. So that last one didn't get me very
Kids,
sick.
yeah.
But the first two children got me sick a lot.
So you and the kid, you're just indestructible at that point.
Well, no, she got sick a lot. I just didn't catch it.
It's sort of like collecting, if you think of it that way. We're talking about ways to stay healthy this flu season. Of course, getting a flu shot is the best option. And we talked about hand washing. Is there other stuff we should think about and be cognizant of?
Covering your cough, you already said that.
Yeah, oh, yeah, you
Your
did say
sneeze,
that.
You did say that.
Yeah.
Hand sanitizer is just as effective as for hand washing,
Right.
as long as your hands aren't visibly soiled.
Yeah.
Speaking of the hand sanitizer, I know that for a while they had a study out with the triclosan stuff that was in some of the hand sanitizers, that it was so dangerous. But for KRMC employees anyway, we don't use a hand sanitizer that has that chemical in it, so we're safe.
It's okay. Go ahead.
You can take him to Choya. When you
Or do they have a flu clinic going right now?
They have a flu clinic right
Oh, I love this. Okay,
there.
perfect. So we'll wrap this up and we'll go down and get a shot.
Right,
Would
so
you
they're
think?
expecting you.
Oh,
Okay.
thank you so much.
Thank you, Karen.
You just
No
made.
problem.
Thank you so much. All right, so we will do this after all. Fantastic. And the other thing that I know I hear often enough is, hey, if you're sick, don't go to work today, right? It's very hard for us to take days off.
It is very hard, especially when you're like most people and live paycheck to paycheck.
Yeah.
But it's so important to protect yourself, protect your coworkers, and don't go to work with a fever.
The fever is the main part. You're very contagious when you have a fever.
So if you're a little bit snotty, but you're kind of, then maybe, but like if you have the fever, that's when you really...
Yeah, that's
Right.
something more serious than a common cold.
Okay.
Absolutely.
And you can always follow respiratory etiquette like people in Japan do. If you have any kind of cold symptoms, wear a mask out in public.
Yeah.
There's nothing wrong with that.
Right. Infection preventionists. I really enjoyed hearing about your job, but I don't think I would sign up for it.
Oh, come on. Don't be scared.
It sounds pretty tough to me. Jenna Durrett and Carroll Howard, thank you so much for your time today.
Thank you.
Thank you.
And who's going to take me down to get a shot?
I will.
All right. let me load up this gear and we'll run down there.
Okay.
All right. Thanks, ladies.
Thank
I'm
you.
sad I already got mine. You're not sick at all.
I'm not sick. Oh, wait, come here. So here we are. We're recording, so don't say anything incriminating again.
Okay.
All right, so we're going to go downstairs and get me a flu shot.
Yes. There's a
any-
flu clinic going on down there.
Anything
by
I
the
need
cafeteria.
to? Am I just going to like storm in line in front of people because I have the microphone?
Sure.
Awesome. All right, that's why I took this job. Is there anything you want to ask me before I commit to this? I'm not sick.
Do you have any allergies?
I'm allergic to pretty much everything.
Eggs?
No.
Okay, then you'll be okay. Or have you
Right.
ever had a bad reaction to the flu? A flu shot?
Bad to the
To the
flu,
flu shot.
indeed. Yes, I had diarrhea and vomiting.
To the flu shot.
Not to the shot. No.
Okay, then you should be okay.
Let's do it.
All
Here
right.
we go.
Have fun.
Thank you.
Thank you.
Off we go.
You're gonna get a shot. You're gonna get a shot.
He wants it in his tush, he said, right? I'm going to tell them that.
How come you're so mean to me?
Want your right or your left arm?
Let's do the right arm. I've been told that I should use my dominant arm.
Is that true? Is that true information? Sarah? Should he use his dominant
I
arm?
always use my dominant arm.
Okay.
All right.
For forgetfulness.
Can you? I'm really nervous. Should I do anything? Should you
Relax.
hold my hand?
Dead weight. Dead weight. Throw that arm down.
Okay.
Dead
Throw it down. Dead weight. I'm not really nervous. Yeah. It's because my biceps is so strong and so big that you're having a difficult time with my. It's because I've been working out lately. I don't know if you can tell. Let's see if this makes a sound when it goes in.
It burns a little bit.
A little bit. Tell me when you're going to do it.
Okay. Oh, wait. You're a bleeder.
Did the
So
needle
it's
break off?
the needle broke off.
Okay. You're done. You're all done.
Oh, we forgot. You were going to talk about slogans.
Yes. Our slogan this year for the flu is a great one. I love it. The life you save may not be your own. Be a flu fighter.
That's like 2 slogans.
It is 2 slogans.
And was there something else too about? Can we say about kung flu fighting?
Oh, I don't know what you want me to say about that one, to be honest with you. We just thought it was cute.
Yeah.
Flu fighting.
So is that it? Am I all done?
You're all done?
So we just get to leave?
Yeah, that's it.
I don't get any cookies or anything?
I need a sticker.
Is a flu fighter sticker?
Yeah, right there has stickers.
Really?
Flu fighter stickers.
Oh, I really
You're an official
do.
flu fighter.
Look at so what does it say? I see be a flu fighter. What else?
So get ready. Stay healthy. I can't read it. It's so small.
Get your flu shot.
There we go.
I would have never guessed that one. Let's put it right there. Yeah. Thank you.
Thank you very much.
Thank you. This was fun, and I'm not only do I know more, and we got to share this information, but I'm also immunized. So we could try to be good examples. I'm out of hands. Thank you.
Bye. Have a good day.
And that's the show. That is Focus on Your Health. I'm TG LaFredo, and I am immunized. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. Thanks for listening. We'll catch you next time.